Hey there, Middle Tennessee. My name is Daniel Adams. I am here with Dr. Kent Lofley of Blue Ocean Family Medicine. How are you, Dr. Lofley?
Doing well. How are you doing today, Daniel?
Amazing. I'm wanting to invite all these fine Middle Tennesseans just into a conversation. I've been getting to know you here over the last couple of months. I love what y'all are up to at Blue Ocean Family Medicine, offering the highest quality care in a really personal way. Um, in an intimate setting, folks get to interact with you on the phone, meet you face to face. You get a bunch of folks in next day to get their medical issues met and to get great care, and it's at a very, very affordable rate. Um, and that's all important, and we can talk about that. But mostly, I just wanted to showcase you and who you be. Um, and I was curious, like, what got you into medicine in the first place?
Yeah, that's a really good question. So, when I graduated from high school, I was interested in computers. So I thought, oh, I'm going to do computer science. This is the up and coming thing at the time when I was going into college. And and then I went on a mission for my church to Brazil. And so while in Brazil, I started seeing people who were living a really kind of underserved,
Mhm.
poor areas, a lot of medical problems that people had just because they weren't, taking care of their basic healthcare needs. And I started to get interested in medicine and then also interested in doing medical missionary work.
Hmm.
And so I came back from my time in Brazil, kind of had it in the back of my mind that maybe I would go into medicine, but I started back in the school doing computer science stuff, and medicine was kind of maybe I'll do that if it's the right thing. But as I started doing my computer science studies, I'm like, this just is not the right fit. I kept thinking about the people in Brazil. I kept thinking about people who just didn't have good access to healthcare,
Hmm.
and decided I really want to go into medicine. So I went ahead and committed myself to, all right, now I'm switching from computer science to biology, pre-medical major. I'm going to go to medical school. Um, and I really haven't regretted that decision.
The body's like a whole different kind of computer.
Yes, yes, it is.
Learning the different programs of the body, I'm sure, is an extensive study. It's cool to hear about your ministry to Brazil. I know there are a lot of folks here in Middle Tennessee that can relate to that and see the need, for those ministries, and God's such a big part of what we do, and a big for me. My faith is it's everything for me and my family, and I appreciate you know that about you too. That's a big pillar of who you are.
Yeah, and it's kind of came full circle because I've had the opportunity to now go on medical missions
Mm.
as a doctor, and it's something that I'm going to continue to do. And my goal is to involve my family in that. So each one of my kids is going to go on a medical mission with me to some country and have that experience. So I was able to take my oldest daughter a couple of years ago to Guatemala, and we were driving up into these small villages in the mountains and setting up a clinic in a pavilion or a school and taking care of these underserved people and doing screening tests and helping them get medications for parasites. And they were able to get dental care and get eyeglasses, all these type of things, and just kind of basic medical care. And it just really warmed my heart. It's like, this is
Mm.
why I wanted to do this. This was like what motivated me from the time I spent in Brazil to become a doctor, and then being able to go back and offer services to people in those conditions helped me go full circle.
Well, that's really meaningful for me to hear, because it's like when I go have an experience with the healthcare system, I usually get passed around to four or five people, and I go wait in some sterile waiting room, and it's like a half day experience, and I sit there by myself forever and just wait my turn, and then I feel like I'm part of this giant machine that's just cranking through people. I get my 8 minutes with the doctor and get my $400 bill later, and it's like, well, geez. But to hear that like you're having meaningful care experiences and that, because the other thing that I notice is like I've been with doctors who care and I've been with most who are, you know, there for a paycheck or so overwhelmed by being in this system that's bigger than them that like they would love to give great care, but they just don't have more than 8 minutes. So,
Yeah.
next. And we're cricking on to
It's
the next. So I love hearing your experience to where like you get to be with people giving great care. And I can tell that you care about what you do, and that's important to me.
Yeah, I was in that system, like the type of doctor's office that you described, right? Where I was a doctor who was seeing 20 to 30 patients a day and spending 8 minutes with the patient. And it's just not sustainable. It's not,
Well, it didn't help me
for
get
me.
well.
Yeah, yeah. So yeah, it really is like kind of like quick type of fixes where you're putting a band-aid on the problem,
Here's
but
a
you're not
pill.
getting down to the solution. Yeah, you're not getting down to the solution.
Yeah,
So for me, it wasn't as meaningful as a doctor to be in that environment where it's just like, oh, we're going to have high volume, see lots of patients, but the quality may not be as high, right? But you're helping take care of a lot of people. So
sure.
it was rewarding work, but it really didn't like fire me up. It wasn't what I
Yeah.
wanted to do for the rest of my life.
And so, now y'all have opened up Blue Ocean Family Medicine, and it's a much more intimate experience. As I've experienced it, like you come in and Dr. Lofley greets me at the door. Like, oh, well, this is different. Like I have a full 60 minutes with the doctor, and he doesn't just tell me what my insurance will pay for. I'm getting like we're having an actual conversation about what's going on in my body and what he's seeing and what he's not seeing and what he'd like to see. And we have all these options, right? And it's like I'm in the driver's seat to make decisions about my own health. That feels amazing. Like I love what you guys are up to.
Yeah, I think it's just such a superior system to be able to really have that time to sit down and have a relationship between two people, right? Happens to be a doctor and a patient, but it's two people talking, coming up with a plan on how you can, have a healthy, vibrant life.
So good. Because that's the whole point, right? Like we're here to create wellness. Let's do
Yes.
that. Tell me some more about the care philosophy.
Yeah. So I chose to become a DO, a doctor of osteopathic medicine. So that kind of spoke to me when I was looking into medical schools. And there are other ways to become a fully licensed physician in the US. You could become an MD, but the DO philosophy really stood out to me. And one of the overarching themes they have is that a person is made up of body, mind, and spirit, right?
So it's all
So
three.
it's all
We're
three.
not just a meat suit.
All three contribute to your health, right? Your thoughts, what's going on in your mind, that contributes to your health. Your spirituality contributes to your health. And then your body, the anatomy, the physiology, that contributes to your health. And so there's this philosophy of trying to incorporate all of that to look at your body, your mind, your spirit as a unit and figure out the best way to help you balance all of that and have wellness.
Because when we talk about body, mind, spirit, my mind just starts going to like, okay, there's a lot of disease of the mind going on right now. I know 2015, I dragged my wife into therapy, convinced that, all my problems were her fault. And as we got down to it, they handed me some data that was like, hey, just so you know, you test for clinical depression. So everything that, the glasses that you're looking through are pretty foggy and everything's going to kind of suck, including your marriage, and oh, hey, you also tested in the clinical anxiety range. So like there's some dis-ease going on in your mind and we're going to need to change that if you want any shot at wellness. And it's been an incredible journey for me to look at the body, mind, spirit connection, to look at how all those work together, and to not just throw a pill at it, right? Like I look and there's 40 million Americans taking depression medication every year, but like, is that helping anybody? So I love hearing what you're talking about as far as like, hey, we got to look at the whole system here because clearly, like throwing a pill at this is not working.
Yeah. And I mean, even if you're dealing with the mind, right? There may be certain thoughts or depression or anxiety. It's like we also have to look at the body because the body can play a role in that too. So it's like, is there another medical problem that could be contributing to feeling depressed or feeling anxious, right? And vice versa, right?
Yeah.
Is it more a mental problem that's contributing to body symptoms?
And it's such an interesting idea too, you know, osteopathic medicine as a whole is viewing the body as like the body will repair itself. Like it's almost like young children. Like young children are curious and they want to learn until adults beat it out of them. And then they don't want to learn anymore and they don't want to be forced, right? So they die and school is a battle every day to send your fourth grader to school. I feel it's like the same way with the body. Like the body will take care of itself and regulate itself and heal itself if I get out of the way. Like it's same way kids are naturally curious. Like don't screw that up. I feel like the body's the same way. It's like a very powerful philosophy to say like, how can I get your body optimized to just do its thing?
Yeah, no, I think you said it very well, right? The body does have that ability to heal itself, to regulate itself. So you just have to see what things are happening in your life that are throwing that off, right? Mm-hmm. And so that may be your nutrition. It may be your exercise or lack of exercise. It may be like structural problems, right? Is there misalignment in your spine, or do you have really tight muscles or things like that? So something we can do there to correct that and then allow your body to work normally. Yeah, all of that plays a role in your health.
I was talking to somebody the other day. They had 18 medications, and you know they got 3 pill boxes, you know, and it's just like this event every morning to try and get on the schedule, so they can take the thing, and they got to take this other pill to undo this other pill, and
and
it's just like, well, man, there's no wonder we're not well.
Yeah. And once someone's on like 4 or 5 medications, there's like an 80 to 90% chance that they're having some type of interaction between the medications that they're taking, right? And each medication has a potential for a side effect. So you have to be careful when you're taking medications to not get in this situation where there's like this pill stacking. It's like you're taking one pill to treat the side effect of this medication and another one to treat the side effect of that medication. And then some people do end up with 18 or 20 pills. And that's where it's time to kind of take a look at, wait, what's going on here, right?
Like my body is clearly not in a clear space to do its thing.
Yes. So it's time to kind of take an approach of reassessing what is important of all of those medications and trimming back to allow the body to do its thing.
So y'all help kind of thin the herd as far as, you know, too many cooks in the kitchen, too many medications going, like you're going to help people, you know, trim some of those out.
Yes. If there's extra medications that we can move out of the way and get rid of those, that's what we want to do, is to have the fewest amount of medications necessary.
And just let the body do what it does best, which is regulate itself.
Absolutely.
That's powerful. And, you know, for me, that resonates on a very deep level. I know my wife's very similar. I know I've been meeting more and more people here in Middle Tennessee that are feeling that same pull towards, you know, how do we get back to wellness? We've been studying disease for a long time. What would happen if we started studying wellness? What would happen if we started, you know, what's working for people? Like, how about I spend time in that space?
Absolutely. Yeah. We really need to, because there is such a focus in the traditional Western medical society of, oh, let's just focus on, oh, there's this disease And with this disease, can we make a pill that's going to fix the disease? And then that's the solution, right? And that may work in some situations, Antibiotics, for example, when someone really has a bacterial infection like strep throat, it works really
Super
well.
effective, right?
Because you have a bacterial infection, you take the antibiotic, the bacteria dies, and that infection's gone, right? And so in the right situation, that's actually a cure, right? Mm-hmm. In other situations, the medication doesn't end up being the cure, right? Just because you have high blood pressure and take a high blood pressure pill, you're going to keep having to take that pill forever unless you make other changes.
Because my body will regulate itself if I get out of the way.
But yeah, if we identify whatever thing it is that you're doing that's like that trigger, right, to cause the high blood pressure, then we can fix that and not have to be on a medication for the rest of your life.
As you're talking, I started making connections and thinking about, some of my friends that are very, very passionate about like nutrition and eating really clean. They trend towards avoiding antibiotics. They trend to avoid immunizations and those kinds of things. Do you work with folks like that too?
Yeah, absolutely. So I'm happy to work with basically anyone who's trying to find wellness and health in their life. And I have a strong belief that everyone has their own personal autonomy when it comes to what they're going to do with their body and their health care, right? And so if you come to me and you've chosen to not get immunizations, that's fine. That's your choice, right? It's your body. You can choose that. And I just like to be able to have open, honest communication and conversations about why did you choose to do that? This is, kind of my thoughts on that. But ultimately, people have to make their own decisions. And there are practices in the area that say, if you don't immunize your kids, you can't come to this medical practice. We don't have any type of policy like that at Blue Ocean Family Medicine, just because I feel so strongly about people being able to have like their medical freedom of choice.
Like each person gets to choose. And that totally rings with every part of my soul. Like I want all the details. I want to talk with a competent, professional that's seen it all. And then I want to go make a decision that fits for me. And I want to talk to my wife about it. And I want to talk to my son. I want my son's input on my son's healthcare, instead of like mandates about what has to be or doesn't have to be. I feel like that's the part of what got us in the pickle, right? It's like somebody told me like, hey, you have depression, so now you need to take this pill. And it's like, well, do I? Like, is there another way?
Yeah.
And, for me, like it's been this great journey to consider what is it in my body and my mind and my spirit that's really going to create wellness for me. I love what you're saying, like autonomy to choose. Like that to me speaks volumes, and it's refreshing to hear a doctor say that you value that.
Yeah, I think it's really important because we need to be on the same team, right? When I'm making this relationship, collaborating, partnering with my patients, it's really about being able to have those honest conversations where everybody feels like they have a voice. It doesn't do any good for me to tell my patients in a real prescriptive way, you have to do this, this, and this. If you're sitting there thinking, well, I'm not going to do any of those things, right? That's not what I want to do. Then we didn't get anywhere. Like the visit is not worth anything. We're not making any progress.
I'm laughing because I started going to I stopped going to the doctor because he talks and I'm just like, I'm not going to do any of this. Like, what? And you're going to charge me $400 for advice that I don't want. Like, who came up with this system?
Yeah. So shared decision making, like partnering for health is just like one of the key foundations of what I believe in when it comes to practicing medicine.
Another thing I've been thinking about too is this element of transparency. The small businesses, the services that I love receiving, that I love investing in, that I love paying for, that I love taking my family to, are the ones that are the most transparent. The nonprofits that I love to give to are the ones that are the most transparent. They tell me exactly where my money's going, how much it is up front. There's no hidden fees. There's no sales. There's no upsells. I don't feel like I'm being taken advantage of. Like, I will give those people my money all day long and all night. Like, I'm happy to invest in services that I feel like are a great value, that have transparency attached to them. You've been in the field for a while. What have you been noticing around, the level of transparency in the industry?
Yeah. In general, I would say healthcare has not been very transparent. Like, working as a doctor, I would sit down and try to have conversations with my patients when I was working in the insurance system, right? Prior to opening Blue Ocean Family Medicine, people would have questions. Well, how much would it cost if I go do that imaging study?
You're
Or
talking
how much
about
would it cost
options. They're like,
Yeah.
okay, how much is this going to cost? And you're like,
I don't know.
I don't know.
I don't know.
The
Because it
insurance
wasn't
company will tell
transparent.
us later.
Exactly. The insurance company will say how much they're going to pay for it later. And then you'll have some type of copay with that. And I don't know what your copay is, because your insurance plan is different than everybody else's insurance plan, right?
Yeah.
They're not all the same. And different facilities charge different fees. If you go to one hospital or one imaging center, you're going to have a completely different price. And so I would say transparency has been highly lacking in healthcare, where, you could go and have services and not know what it was actually going to cost until a few months later.
I had that experience.
Yeah.
I was seeing something on y'all's social media that's got like a breakdown, like transparently, what most insurance-based family medicine costs and what it actually costs and what y'all are offering at Blue Ocean Family Medicine. And these were staggering to me. The cost of Lexapro on average is $56 at the pharmacy.
Yeah.
The actual cost, like if I sold that at cost, tell me if I understand this correctly, is $1.77.
Yes.
So if I go to the pharmacy, it's $56 for a thing that costs $1.
Yeah, pretty much. Yeah.
And this is part of the transparency problem, where like, I'm sure that'll help somebody make money, but it's not helping me get a lot better. Like, this is an issue.
Yeah.
And it's amazing to me that y'all can offer this at cost. Like, it's actually $1.77 and you administer it right there in your practice, and you're offering it for as much money as it costs for you to buy it. You turn around and give it to patients at the exact same cost. That's incredible to me.
Yes, it can be a huge savings from those on the medications.
Some of these other things, on this diagram on y'all's social media, Blue Ocean Family Medicine on Instagram and on Facebook. When I went in for labs for some blood work, I was having all sorts of like stomach inflammation, craziness, like all this 8 out of 10 pain. I couldn't eat anything. And I went in, they said, yeah, you need labs. They're going to be $400. And I was like, maybe I'll just not eat. Like, I don't know. Like, I don't want to deal with that. But what I'm understanding is y'all offer labs for between $15 and $30 because that's how much they cost.
Yeah, it really just depends on the panel of labs that we run. But like a basic panel that you would do with preventative screening lab tests with a physical, it's going to be between $15 and $30.
That's amazing to me. Like, I had kidney stones. I didn't know they were kidney stones. I just knew that I was like vomiting on the floor in fetal position, and I had never experienced anything like this. I was 24, I think. And I was just like, what is going on in my body? Like, I've never felt pain like this. I go into the emergency room thinking that I'm probably going to die, and the lady at the front desk was like, I'm 90% certain you've got kidney stones, but I can't tell you that because I'm not a doctor. So don't quote me. And I was like, well, what do I do? And she's like, well, just sit over there. And I was like, I'm not sitting anywhere. Like, I can't. Like, I'm gonna
Mhm.
die. And she's like, no, you'll be all right. We'll get you in here in another hour or so. And they take me back and they're like, do you need this Oxycontin, whatever? It's $800 for these, pain pills. And we really want to take you back for a CT scan. I was like, well, how much is that? And they're like, it's 2,400. And I was like, $2,400 for you to tell me if I have kidney stones or not? And they're like, well, yeah, we just want to make sure we're thorough. And I was like, hey, I appreciate the highest quality care, but like, we're talking about a $3,500 visit. And what they really did was they handed me a strainer and said, go pee into this. And I peed out the stone and then I was done.
Yeah.
I like, it's staggering to me. And I know there are things that can get complicated. And, the stone was 2 centimeters and not 10 and whatever else. Millimeters, I forget all the things, but
Yeah. Millimeters, but yeah,
centimeters would be a hell of a thing.
it'd be big.
But what floored me was like, I'm understanding that y'all can do MRIs for like hundreds, not thousands.
Yeah. Yeah. So there are imaging centers that are independent, from the hospital where they give us just a transparent cash pay price. And so you can get some of these imaging studies done for hundreds of dollars instead of thousands of dollars.
And that's amazing me. Like transparency up front, right? Like I want to know what it is. I want to know how much it costs. Give me all the details. I don't want no up sales. I don't want, monthly installment plan. That's fine, but like I got to know all the details up front if I'm going to make an empowered decision about my health. And I love that that's part of y'all's philosophy is to be as transparent as possible and just have a conversation, like explore all the different avenues of body, mind, and spirit. And then if you need an MRI, go get an MRI, but it's not going to be $3,500. Like that's amazing
Yeah.
to me.
Yeah, exactly. Because a lot of these costs are just really inflated, right? Because we were having a conversation about this earlier. The insurance companies like to haggle with the imaging facilities about how much they're going to pay them. So the imaging facilities raise their price so that they can negotiate.
First law of bartering, right? Like if I got to start high if they're going to talk me down.
Yes.
I thought, and this is what's going on in the medical. Like you're right in the middle of the medical scene, and this is what you're telling me is going on at the hospital every day.
Oh yeah. Yeah. That's what's going on. It's like they're going back and forth with the insurance company. The hospital is trying to get paid at a certain rate, and the insurance company is paying, well, we only want to pay this much.
And meanwhile, I'm sitting in the waiting room for an hour trying to not hurt. Or, scheduled 26 days out.
Yeah.
For
And then,
for my pneumonia, unless I get to go into the ER and make some noise.
yeah. And then the people who end up paying the highest rates are the people who don't have insurance because the hospital is billing you the same rate that they're billing the insurance company, like that kind of inflated rate, right? And you're getting that same bill, but you don't have the same negotiating power that the insurance company
so you're just
does
paying in
say,
full.
yeah, so I'm going to pay less.
And it's just how much it costs to see the doctor for 8 minutes when I'm there.
Yeah.
I mean, like I knew the system was a little wonky and that it was kind of inflating out of control. Like to be talking to you and other medical professionals that have been in it in the front lines, like just trying to give good care to people. It's been really eye-opening to talk about y'all's experiences from the inside. And I appreciate so much the solutions that y'all are creating, with things like direct care family medicine that's just got a monthly flat rate subscription of $65 a month. And that takes care of, so many of these visits that I've got an $80 copay on anyway, plus whatever they charge the insurance companies. Really inspired by the work you're doing, where it all started in ministry for you, the whole approach of like, we're going to look at the whole body, the whole system, the body, the mind, and the spirit. I love that you're a man of faith. I appreciate that from my doctor. I get the sense that it's almost like we're returning back to the to the old way of family medicine where the doctor shows up in the buggy and gives you something to chew on and some whiskey and you just get it done.
We're definitely going for that type of relationship, right? Where it's you and the doctor really trying to just take really good care of your health.
And to be clear, like there are all these technologies and different techniques that you use with osteopathy and different techniques there. So it is high quality medical care. It's not just chew on this piece of leather and we'll give you some whiskey. I guess that was misinformed, but I hear people talking in birth situations, and it's what would we do if we weren't in the hospital? And it's like, well, what did people do for 6,000 years before we had hospitals in the early 1900s? Like people have had babies a long time. And there's so much wisdom in like coming back home to our bodies and getting clear on what's going to create wellness, and considering all those different options. Very much appreciate your work.
Thank you.
Anything else you want to share with the good people of Middle Tennessee?
Just so grateful to be here. My family moved here a little over a year ago, and it's been such a welcoming arrival. Everyone's been so friendly and welcoming for us in the community, and I'm just so excited to be here and help serve the people in Middle Tennessee.
Amazing. It's been a great conversation. Thank you so much for pulling back the curtain. Thanks for the transparency. Thank you for the inspiration. And I'd highly recommend checking out Blue Ocean Family Medicine. What's the website for y'all?
Yeah, so it's blueoceanfamilymedicine.com. And you can read all about our pricing on the website. You can schedule an appointment to get in and be seen. Or if you just want to have a little bit of a one-on-one conversation, you can schedule a question and answer session directly with me, and we can do that through a phone call, video visit, or you can come into the office.
Man, personalized healthcare. Here's the wave. Meet directly with the doc. I love that. Well, thank you so much for the conversation today. God bless you, Dr. Lofley. Appreciate you.
Thank you, Daniel. God bless.